Excellent. Okay, so what I would love for you all to do is just close your eyes for a moment, sit in a comfortable position or stand or like be in any position you want to be in. Close your eyes, take a deep breath. Try to feel your entire rib cage, belly, chest, everything fill with air like a balloon being inflated, and then deflate. Same thing again. Big, deep inhale. Inflate your balloon and deflate. You can keep your eyes closed. You can open your eyes. You're going to lower your chin towards your chest or just bring your chin towards your chest. And then bring your head back to an upright position. Same thing again. Nod your chin towards your chest. Keep breathing as you're moving here. And then bring the head back up. You're going to do that one more time. Nod your chin towards your chest. And then back up. You're going to turn your head to the right. And then back to center. Turn your head to the left. Back to center. One more time in each direction. Turn the head right and center. And turn left and center. You're going to bring your ear to your shoulder and then back to center. Other ear to the other shoulder and back to center. One more time, each side, ear to shoulder and center and ear to shoulder and center. We're going to do one more little movement sequence to open up the spine a little bit. So if everybody's comfortable coming into an all fours position, so hands and knees, you're going to do a little cat-cow, which is just rounding your spine and extending your spine. It is a movement that probably has many different names, but that most of us are most likely familiar with in some sense or another, right? We're just moving the spine in two directions, round and extend, right? And you're continuing to breathe. And any type of breathing is fine. One more time in each shape. Excellent. And then you're just going to find like a straight spine, right? Neither rounded nor extended, whatever you perceive to be straight. You're going to take one arm, reach that arm up to the, and then bring the arm down and through, lowering your shoulder to the floor, right? So some people call this thread the needle, but it's rotating through the spine, right? So we rounded, we extended, now we're rotating. And you're continuing to breathe a couple more times in the same side or on the same side. Last one. And then we're going to do the other side. Bring the other arm up to the ceiling. Let your gaze go towards your hand. And then bring that hand down and through. And again, up and twist. And down and through. Two more here. And down and through. Last one. And down and through. Excellent. Go ahead and bring yourself to a comfortable position. And we're going to get started just on a little bit of kind of like intro to the foundation of how I go about creating a home-based program and how you can think about creating a home-based program for yourself, how you can progress that over time and find something that is sustainable and works for you over time, right? So we can start the first slide if you're ready. Excellent. So I'm calling this presentation the nuts and bolts of evidence-based movement. And so we're going to use that idea of evidence-based movement to create a home movement practice. And you can change to the next slide. So first, we want to talk about what evidence-based actually means. And it is the intersection. A lot of people, I feel like when we think about evidence-based, we think of it as like very much science-based, but it really incorporates 3 pieces that help inform kind of best practice, right? When we're dealing with an individual human being, rather than kind of this general set of like research experience or research evidence that we find. So what is evidence-based movement, or what is an evidence-based practice? We do start with what research says, right? Because it is a good foundation. Research can generally and is generally aimed at being applied to kind of a broader range of people, but there is of course a lot of nuance in that. And it doesn't end up applying to every individual human being, which is who we are and who we work with. So we have to incorporate more than just what research says. We have to incorporate what our clinical experience is. So what my own personal experience is in dealing with the clients that come into my studio, right? And in research, those are called case studies. And they really just look at one incidence or one experience, one person's experience, right? And that cannot necessarily be applied to a broad range of people, but it still is valuable and it still is informative. The last piece is patient experience or client preferences, right? So research can say one thing, and our clinical experience can tell us one thing. And then if the person in front of us either like doesn't like what research says, or like what research says and our clinical experience doesn't work for that person, right? We have to figure out how to integrate all of these things into something that is valuable for the person in front of us. And, I don't know how other practitioners feel, but that is to me the biggest part of this diagram, right? Is what is the person in front of us? What do they enjoy? What do they like? What works for their body? What is achievable for them long-term? What makes them happy, right? All of these things are going to tell you what is applicable in that situation. And so I would encourage you to think about that patient preference or client preference as yourself in creating your home-based movement program. So you can, look at research and be like, oh, research says this, right? But how do I feel about that? Is that useful to me? And our number one goal is to make whatever we're doing sustainable over the long term, right? So you can change to the next slide. Excellent. So let us start with what research says, because it is a good foundation. I am taking this from the American College of Sports Medicine. The ACSM recommends 150 minutes of moderate intensity aerobic activity every week. So that's like 3 times per week of a half hour or so of aerobic activity, right? And what does aerobic activity mean? Anything that gets your heart rate pumping. They recommend 2 times per week of muscle strengthening activities, 2 or more days a week that work all the major muscle groups, right? And so what does that mean? That means like lifting heavy stuff, picking up weights, or maybe picking up a bag of dog food, right? So that's what the ACSM recommends. That does not mean that it is doable for everybody, right? 3 days a week of aerobic activity might be a lot for you, right? 2 days a week of strength training might be a lot. And so we can start from that base and then try to apply it to an individual situation, right? So my clinical experience might agree and say that, yeah, 3 days a week of aerobic training and 2 days a week of strength training is great. If we can do that, amazing, right? Do it. What does that look like? Does it mean like walking? Does it mean running? Does it mean rowing? Does it mean surfing, paddling? Does it mean going to the gym 2 days a week, right? Those are all kind of the individual preferences that we plug in along the way. And again, sustainability is the most important piece, right? So it doesn't really, I mean, it matters what research says, of course, but when it comes down to it, it just matters what you're going to do and what is sustainable for you. All right, next slide, please. And so some things to think about going into your home-based program and deciding what is sustainable for you is that strength is important, especially as we age. I'm 40 years old, and you know, it is important for my body at my age to try to maintain muscle mass over time, right? Because this is one of the biggest determinants of aging, and our ability to continue to move through life and do the things that we want to do and have an enjoyable life is to maintain strength over time. And that means for me that I really want to embrace this idea of my body being anti-fragile, right? As in, I'm not breakable. I'm not going to be, what's the right word I'm looking for? I know we have all these little bullet points on the side that I will get to in a minute, and we'll talk about the SAID principle. But embracing an anti-fragility kind of mindset is just that, you know, I'm going to try to continue to build strength over time, even through a little bit of discomfort or pain that I might experience, which everybody does, right? So if you would like to put in the chat how many of you have experienced long-term pain or intermittent pain, right? You can not put it in the chat. You can also put it into a chat privately, right? But I know that over time, I've, you know, had a few injuries. They kind of come back every once in a while. But it's always interesting to kind of relate how we deal with that pain, right? Some pain is intermittent. Some pain is like kind of hangs out for a long time. And sometimes yeah, for sure. Back pain absolutely counts. And in fact, back pain is like the number one long-term pain that people deal with, right? Yeah, for sure. Joint pain from old injuries, back and hip. Yeah, awesome, right? So most of us at some point or another in our life, we deal with pain, right? A lot of people put in their back pain. Back pain is kind of the number one long-term pain that people report dealing with, right? And a lot of it is what's called non-specific back pain, which just means that there's no diagnosable cause of that pain. It's not necessarily mechanical pain, which means that like, oh, I tore my muscle and I'm having pain from that, or I tore a structure in my body, I'm having pain from that. Right. So pain is a very, very complex issue, and that's definitely a topic for another day. But it is what's called a multifactorial issue, is that we often cannot apply one cause to that pain. And what research currently tells us right now about, in particular, back pain, because there is so much research on it, is that moving through that pain within limits of our own personal comfort is more important than resting. And that is a very nuanced statement, right? Because again, we go back to the client preferences. Like, what amount of discomfort are you comfortable moving through? And that is how we want to approach exercise. And I wanted to talk about this, like, pain and discomfort piece, because so many of us encounter this throughout our life, and it often stops us from moving, right? And so the point that I want to drive home here is kind of this SAID principle, is that our body adapts to specific demands that are imposed upon it. Specific adaptation to imposed demands, right? Which translates into the body is going to adapt to the demand that you place on it within your levels of comfort. Something to keep in mind doing that, right? Moving through pain as you continue to move through life, is that your pain does not necessarily always correlate with tissue or structural damage. And that we are generally, as humans, we are not fragile, right? And so last bullet point is that it's about balance and not abstinence of movement. And I think that this is a really, really important thing when thinking about how we can develop and continue long-term programs over time, movement programs, because, we will have days where it's like, ooh, my back is feeling a little bit tender. What does that mean for me? Maybe I need to do some movement, right? Maybe I need to try that. If that's not working for you, maybe you do need to rest, right? These are not like hard kind of lines that we want to draw. But the point of this slide, right, and kind of sharing how common discomfort in movement or pain in movement is that it is important to not always go directly to, oh, I need to rest, right? Because maybe you need to move, maybe you need to build some strength, and that strength will help support you, or that strength will help you relate to your nervous system a little bit differently, right? Because pain is so multifactorial. We don't always know what's causing the pain, and it's not always a mechanical issue. And please, if you have any questions, feel free to type them in the chat. I will try to keep an eye on that, as well as to keep an eye on the time, so that we can do some movement here. Let us move on to the next slide. Awesome. Actually, let's go back one slide. Perfect. And we are going to start a little movement portion. Does anybody have any questions about any of the previous things that I talked about, or specifically this idea of what it means to move through pain? I know it can be a kind of a not necessarily controversial topic, but it might be something that is takes a minute to get on board with. And I totally get that. I think that, the important thing to remember is that this is very much an individual thing. It's not meant to get you to do something you are uncomfortable doing. And it's not meant to get you to ignore your pain either, because pain is real. It doesn't matter whether we can put a specific cause to that pain or discomfort, right? It's real for us when we're feeling it. And we need to definitely like pay attention to those moments when we do feel discomfort and pain. But sometimes like kind of just being like, all right, I'm just gonna I'm gonna move. I'm gonna do something that feels good for my body, whether that's go for a walk, go for a swim, get down on the floor and like roll around a little bit, right? All of those things can help change the sensations that you're feeling in your body. And it's just an idea that we can keep in mind kind of going forward long term, or with like a long-term movement program. Excellent. So if nobody has any questions about that, let's get started with a little bit of movement. So if you want to find a space that you are comfortable moving in, you've got some room around you, and also have access to a wall space, that would be excellent. If you don't have access to a wall space, that's totally fine. Not completely necessary, but I will go through some iterations of a little bit of a movement sequence that you can use the wall with. But again, you don't need a wall. So, do what you can here. So we're going to try to, the way that I think about building a movement program is one to think about shapes, right? We want to move our spine in all directions. We want to try to use the sides of our body, the front of our body, the back of our body. We want to use all joints in our body, right? So just kind of like giving a little bit of love to like every part. So what I'm going to start with first is a basic roll down. So what you're going to do is stand up. I'm just going to tilt my camera up so hopefully you can see my whole standing position. Awesome. Okay. So you're going to stand with your feet under your hips. And you could also do this standing against a wall, which is fun. It's not necessarily easier or harder. It's just gives you different feedback. You're going to tilt your chin towards your chest, and you're just going to kind of melt forward, right? You're going to roll down. And you're going to let your body do whatever it needs to do, meaning you can bend your knees. That's totally fine, right? You can let your head hang. You can go down really just as far as it feels comfortable going down, right? You might hit kind of a wall halfway down and be like, ooh, that's enough for me, right? That's fine. And then you're going to roll back up, right? For some reason, I always imagine like peeling a banana, right? You're like a banana peel coming off of a banana, or maybe a fruit roll up coming off of the wrapping. You're going to roll down. And then you're going to put the peel back on the banana. You're going to put the wrapper back on the fruit roll up. You're going to roll yourself back up, right? This movement, and you don't need to know this to do the movement, obviously. This movement is called flexion of your spine. We are flexing the spine, right? So this is moving the spine in one direction. It's really interesting to think about how our feet relate to this movement. So a couple more times, we're going to roll forward, whatever that forward position is for you. And then to roll back up, I want you to think about pushing your feet down into the floor, right? Maybe like you're a little plant growing up from the soil. One more time, thinking about that push of the feet through the floor, go ahead and roll down any amount. Push your feet down into the floor to roll back up. Awesome. All right, so let's get down on our hands and knees. We actually already got to do this movement in the intro, a little bit of cat-cow, right? And so I want you to think about, as we're going through these little pieces of movement, is that you can take one and use it as a base to build a movement program on, right? You can rearrange all of these pieces. And this is not something you have to do like roll down, then cat and cow, then do the next thing, right? So these are just all kind of different ways to move your spine in a rounded shape and an extended shape and a twisted, you know, all of those things, right? So here we are, we're gonna go around again for the cat cow and extend, right? Extension for the spine is just like arching of the spine. You might have a different name for that shape of your spine, right? But you can think of it as the opposite of the rounded spine. And so just kind of move through those two shapes, right? And you're gonna make those two shapes as big as you can. You're gonna let your head be involved in those two shapes, right? So you round your spine and you look towards your belly button, and you extend your spine and you look up towards the ceiling. Couple more times. And extend the last time. You're gonna round and extend. Awesome. You are gonna come to a neither rounded nor extended position. So what you perceive to be kind of like a flat spine. And imagine you have a tail, right? You're gonna wag your tail one direction and you're gonna try to look for that imaginary tail as you wag in one direction, right? And then you're gonna do that in the other direction. You're gonna wag your tail the other way. You're gonna look for your tail over your shoulder in the other direction. Keep going, make that movement as big as you want, right? This is what we call lateral flexion or side bending, right? So you might feel that you're like stretching through your rib cage or stretching through your sides, or maybe you feel this in your neck more than anywhere else, right? We are all gonna feel things in different ways. And that is just part of being a human being, right? We're not all gonna feel every movement in the same way, and that is okay. So a couple more times, just wagging right and left, right? You could do all of these spinal movements seated. You could do them lying down. You could do them standing up, right? Multiple ways to do these. You could do them on your elbows. If your wrists are quite bothersome for you and you're like, I'm not cool with that level of discomfort that I'm feeling in my wrists, maybe you want to drop down to your elbows. That's fine. Absolutely. Let's go from our tail wagging again back to our thread the needle, which is rotating the spine, right? So you're going to take one arm, you're going to reach that arm up to the ceiling, you're going to look towards that hand, you're going to let that hand dive under the other arm and drop the shoulder to the floor, right? Same thing again, reach up and drop. Your eyes can really help inform where your body goes, right? So if you're looking in the direction of your hand, if your eyes are following kind of that moving hand, you're going to really find that your body kind of more effortlessly follows the movement you're trying to do, right? Because your eyes are kind of telling you where to go. Let's do the same thing on the other side. We are rotating our spine, right? And so with that, we've flexed, we've extended, we've side bend, we've rotated, we've moved our spine in every direction. This is a really nice way to just warm the body up. And like I said, you could do this seated, you could do this lying down, you could do this standing up. Whatever feels good to you, whatever your space allows. And then go ahead and come back to center. Excellent. So there are some fundamental, what we call fundamental human movements, which we can name a few of, and that we'll practice today. As humans, we push things, we pull things, we hinge, we lunge, right? We ambulate, right? Which is we walk, or we use other mechanisms to move around. But right, if we're maybe not ambulatory in a wheelchair, we're using a push. And so we're going to go through some of those kind of like fundamental human movements because they really help us practice how to move well through life and how to think about staying strong through our activities of daily living. So we're going to start with a push, which I am going to kind of dial down to a plank, right? And if we think about a plank, we are pushing whatever surface our hands are on, we're pushing that surface away. So it can be the start of a push. There are many other ways to push, but we're going to kind of narrow it down to that way to push. This is where, if you're like, oh yeah, plank is not my thing at all, this is where a wall space or any type of elevated surface like a desk or a chair will come in handy. I am going to go to the wall, and I recognize that my back is going to be to you for a moment, which is kind of awkward, but it is just the way that my space is set up. So if you're at a wall, right, you're going to put your hands on the wall, and you're going to walk your feet slightly away from the wall so that you are leaning into the wall with your body weight, right? And that is going to allow you to push your hands into the wall to create that idea of a push, right? So if you're at a wall and that's your space, you're going to do that. Kind of, that's a good place to start also if you just don't know where to start, right? If you're like, I don't know what I feel, start on the wall and be like, okay, that was too easy, or that was just right. If you want to try something that's a little bit more challenging, go to a slightly elevated surface like a chair or a desk. You're going to put your hands on that elevated surface and you're going to walk your feet back, right? And you're going to find a plank shape here. I want you to, whatever surface you're on, I want you to push that shape away, right? Or I want you to push that surface away. You can also come down to your elbows, right? If you're like, yeah, I feel strong in a plank position, but just not on my hands, drop down to your elbows, right? That is still a push, right? You're still pushing your surface away, whatever that is. And it's quite challenging, right? An elbow plank is very challenging. So wherever you are, go ahead and take a rest because I don't want to have you hold plank for like 4 minutes straight. We're going to do that again. We're going to hold plank and we're going to build a little bit off of that plank. We're going to go from the push into the pull. And we're just going to kind of keep moving here because time flies. Alrighty. So go back to your surface. If you want to try something that's slightly more challenging, you're going to either come to an elevated surface if you were at the wall or come to the floor if you were at your elevated surface. All right. So I'm going to go to the floor here and I'll just tilt the camera down slightly. Awesome. So here you are on your more challenging surface. You're going to come into whatever your plank is, and you're just going to hold it. Awesome. Push your surface away. And now this gets a little exciting. You're going to take one hand and tap your shoulder and then back down. Yeah. Other hand, tap your shoulder, back down, right? If you're on your elbows, you're just going to take one elbow away, back down, other elbow away and back down, right? That can be quite challenging. All right, go ahead and take a moment. Awesome. That was, so if we put weight to that, right? If we have a dumbbell, say, we can take our hand and we can pull the dumbbell up and back down. That would translate into a pull. Awesome. We can go a little bit over an hour. That can translate into a pull, right? A pull is really just anything that is the opposite of a push, right? And we'll kind of talk about pulling and pushing as we move into the hinge as well. So just to recap the push and the pull, we have our plank on either a wall surface, an elevated surface of the floor. We're pushing the floor away. There's our push. And then if we take one hand away, we can start to translate that into a pull, right? If we add resistance to this pull, we can start to build what's called progressive load over time, right? Or just start to really feel what that pull is like. So the hinge primarily talks about, or primarily refers to, I'm going to stand again, so I got to do that, primarily refers to this thing that happens at our hips. So if you would stand for me wherever you are and take your fingers and put them not necessarily up on the top part of where the pelvis is, but more like where you feel like your leg folds, but your pelvis doesn't really move, right? So you can kind of like do some marching to feel that. This is the place that we hinge from. So we put our fingers there and we just start to shift our hips back and let our shoulders tip slightly forward. This is a hinge, right? We can also say that this is, in strength training, what we call a deadlift, right? Or it's the beginning of a deadlift, right? And we can add weight to that. And then once we add weight to this, right? If you've got a couple dumbbells lying around, or if you have a couple like cans of food or water bottles and you want to use them to practice a little bit of deadlifting, you can, but also you don't need weight. And we can just kind of talk about what this movement can be if you did add weight to it, or why it's just useful to have this movement kind of dialed in, right? So hinging at the hips. And I want you to think about all of the different ways that you do this during the day, right? How many times do you pick something up off the floor? How many times do you, get something out of the washing machine, right? So we are deadlifting all day. We just want to know how to do it kind of well. So if you have weight and you're going to pick weight up off the floor, you can think about this deadlift as a pull, right? It is a pull with your arms. We can also think about how this deadlift is a push with our feet as we stand. Kind of back to the first thing that we talked about, rolling down, rolling up, push the floor away with the feet, or in our plank, we're pushing the floor away with our arms. That is a push, right? So many people think about the deadlift as a push with the feet and a pull with the arms. So we can combine those three things into one, right? You can start with just the hinging movement, and then you can add load over time, right? Depending on your level of comfort. The last thing that we're going to talk about today is a lunge. So what I want you to do, I'm going to tilt the camera down one more time. What I want you to do is come into what's called a half kneel. And if you're on a hard surface and you're like, ooh, that looks like it would not feel great on my knee, you can put a pillow underneath your knee, maybe roll your mat up and put your knee on that cushioned mat. And then it might provide a little bit of a softer surface for you, right? I want you to think about your knee being under your hip, like you're standing on one leg, right? And that's kind of one of the most transferable things about our lunge movement is that it helps us with balance. It helps us with kind of this idea of moving in a unilateral way, which is helping us walk a little bit better, right? If we boil down walking to its most fundamental aspects, it really is balancing on one leg. If we dial balancing on one leg down a little bit, we can go into this kind of half kneel position, right? So this is my left leg here, my knee that's under my hip is my balancing on one leg, right? And then I'm just gonna try to lift my front foot off the floor briefly and not really change anything else, right? Yeah, awesome, right? And if you're kind of wobbling around a little bit, that's fine. If you lean back a little bit, that's fine, right? Your goal is to just kind of like hang out and lift the leg, but it might take some practice and time. Maybe you want to hang out next to a wall, put your hand on the wall for a little bit of balance so that you can focus on just staying in the same place as you lift that front leg, right? Let's go ahead and change sides. One knee down, other foot forward. You might notice that this side, your second side, is significantly different from your other side. Very normal and natural human thing to do. Have one side be different from the other, right? Awesome. Yeah, tucking the toes under on that back foot can help you find a little bit more balance. It's also kind of a tremendous stretch, at least for me, for the front of my right leg. I'll go ahead and lift, right? Give it a go. If you want to stick with that, you can stick with that. If you want to try standing up from this lunge position, you can do that, right? All the way up. Step together if you went up. Put the other foot back. And all the way down. If you stayed down and stuck with lifting one leg, do that a few more times and then switch sides. If you're going up and down with a lunge, come with me again. We'll do one more on each side. Lunge down. Good. Up, together, down. One more. Wherever you are, nice. And all the way down. Excellent job. Alrighty. So we went through pretty quickly a few kind of fundamental human movements that can help us move better through our activities of daily living, right? We moved our spine in every direction. We went through a push, we went through a pull, we went through a hinge with a push and a pull. And then we went through a lunge, which helps translate to or helps transfer into gait, helping us be better at kind of walking, which is something that we want to be really good at because we're probably doing it a lot every day. So you can, if you would, go to the last slide. And we can just talk about kind of the things that you might want to keep in mind when you're building a home program. These are the things that I tell my clients when they want to augment what we're doing here into a home program. One, I showed you just some exercises that I like to do. However, those are not like, you don't need to do those exercises. There is no one best way. There's just the way that's best for you. That can take a little bit of exploration. There can be a little bit of trial and error to figure out what you like, what feels best for you. Maybe it looks nothing like what we did today, and that's totally okay, right? We didn't talk so much about load, which just means like external weight. We did a little bit in the Hinge, but the idea of kind of linking what we did today to that idea of anti-fragility and kind of building strength over time is that, you know, we want to allow our body to adapt to the demands placed on it. Whether we like lift weights at the gym or not, we lift stuff every day. Like we lift groceries, we lift car seats, we lift children, we lift awkward objects, right? And so we're really trying to make our body resilient for those things. Because those are usually the moments that we tend to like incur an injury, right? Like putting the car seat in the back seat or picking up our, 2-year-old child seems to be when we get the like twinge in the back, right? And so in your exercises, adding a little bit of load, whether that's like water jugs, or, dumbbells at the gym or a kettlebell or a barbell, or whether that's like cans of food. We want to think about how we can incorporate load, external load, into our exercises. We also want to think about moving with purpose, which really just means like when you're going to do something, there is no right or wrong way to do it. There's just what you're going to do on purpose or what you're going to do without thinking about it. We want to try to do things on purpose, right? So if we're going to round our spine, we want to round our spine on purpose. If we're going to hinge, we want to hinge on purpose. When you're building your home program, you want to think about shapes, right? So we kind of started with shapes. We started with making all different shapes in our spine, right? So you want to think about how many different shapes you can make in your spine or in your entire body. We want our body to be able to move in all directions. There are no directions that are bad directions, right? We want to start moving, or we want to keep moving within our pain limits, right? So you get to decide how much discomfort you are comfortable with if you're in pain, right? But kind of the takeaway that I like to give my clients is, I don't want you to stop moving just because you're experiencing discomfort, because it might help you to move through that discomfort. I think making a habit of your movement is also really nice. I'm very like schedule oriented myself. So I know that I have to carve out a specific time every day to move, or else that gets lost in my schedule, right? So making a habit out of moving, even if it's 5 minutes once a week to start, right? And your habit should start with something that you are about 90% confident you can sustain over the long term, right? And like set the bar low. And that's not meant to be like a, set the bar low and don't accomplish anything. It's like set the bar low so you can be successful, right? Because those feelings of success are going to keep you coming back to that habit long-term over time. And then lastly, ask yourself if you like what you're doing. It's going to be, whatever you're doing is going to be less sustainable if you don't like it, right? So if you're like, oh man, I hate running, but I think I should be running because, it's supposed to be good for me. If you hate running, don't run, walk or swim or row, right? Back to the first thing, there is no best exercise. There's just the one that's best for you. And that's where I stop. That's what I have for you. That's kind of what I wanted to share with you all, is just, you know, the importance of building strength, whatever that means for you. It's something that you can do on your own. You do not need an expert to do it, right? You can be autonomous, and you can, you know, create your own program that works for you. So thank you so much for spending this hour with me. I hope that you got some value out of it. If you have any questions, please